Hello, you all out there. Happy Friday. Hope everybody's doing okay this afternoon. My name is Dr. Shayla Toombs-Withers. I am the physician owner of Essence of Health Wellness Clinic. And today we will be chatting about vitamin D, particularly about vitamin D deficiency, and why it's important to be on vitamin D as a supplement. So, actually, this topic was suggested from one of the page followers after my post yesterday about seasonal affective disorder. SAD disorder is the acronym for it. One of the followers did have some questions about vitamin D, and so I thought it'd be perfect to chat about vitamin D today. So, first off, what is vitamin D? So, vitamin D is just what's in the name. It is a vitamin. It's the D vitamin. And what it does is it helps for us to process calcium and phosphorus in our body. And the reason this is important is for bone health, for muscle health, for health in our cells, as well as in reducing inflammation within the body. There are a number of studies on vitamin D, and so even beyond these things, there have been a number of other helpful reasons that people have found that vitamin D can be supportive and healthy for a significant number of other problems as well. So why would one become deficient in vitamin D? Well, there can be a number of reasons why people can become deficient in vitamin D, but some of the more common causes is a lack of intake. So just not taking enough vitamin D. A lack of absorption, meaning your body, even the vitamin D that you may naturally get, your body is not taking that in properly and absorbing it properly to be used by your cells. A lack of sun exposure, which kind of goes along also with that lack of natural intake of vitamin D. Increased breakdown of the vitamin D from your liver, actually, or a decreased ability to actually make any vitamin D on your own. Our bodies do make a certain amount of vitamin D, but as we will find that we don't naturally make enough, and there are some people who don't even make even as much as others in terms of enough to be sufficient to prevent problems from lack of vitamin D. So when you are looking to see if somebody is actually deficient in vitamin D, you do, of course, want to talk with your doctor. You want to discuss with your doctor what symptoms you may have been having. And upon that, they will do a lab test. That lab test is called 25-hydroxyvitamin D. If some of you all I have some patients who are more stickler, so they will look at their lab panel and it'll just look like 25-OH vitamin D on that panel. And so that is what's measured. And so then when we look at that and get the results, a person is considered to be deficient or to have an insufficient level of vitamin D if that level is below 20 in most instances. However, there is a gray area of that level being between 20 to 30. There are some research that has shown that even less than 30 can be significant in terms of being called a deficiency or insufficiency. So I say 20 to 30 is a gray area, but it definitely would not hurt to supplement in somebody who has a vitamin D level of less than 30. Some of the symptoms that people may experience when they do have a low vitamin D level, they can get bone pain. They can feel muscle weakness. They can easily get fractures. A lot of times we'll see this in the elderly population where they have a more propensity to get fractures because their vitamin D levels are low. People who may be feeling chronically fatigued or tired all the time. People who have problems with their wounds healing. Commonly, as with the post that I posted yesterday about seasonal affective disorder, depression is a huge thing that we see where people are commonly vitamin D deficient. And so all of those things would be reasons for you to have your vitamin D level checked at that point. There are some populations who are at risk of having a lower vitamin D level than other populations. People who are dark skinned individuals, and that comes from, as we discussed earlier, about the decreased absorption of that due to increased pigment of the skin. So those populations can be more at risk of deficiency. Obese individuals can be more at risk. Certain medications. So, if your doctor puts you on certain medications, that's something they're gonna monitor if they know that's one of those medications that can cause you to be deficient in vitamin D. People who are in the hospital and people who have been institutionalized for whatever reason, they can be also deficient in vitamin D. So commonly people will ask, well, how much vitamin D should I be taking? And I tell people all the time that level, it's really variable. And it's, based off of a number of things. One, are you one of those individuals that fall into certain of these populations? Two, has your level been checked and what was that level? And three is your age. And all of those things will play a part in how much vitamin D should you be taking. So just some basic guidelines. Babies, particularly breastfed babies, should get 400 international units of vitamin D every day. To moms who are the mothers of the breastfed babies that I see in my practice, I usually will recommend a vitamin D drop. I find that's easy for a baby to ingest, and it's easy for a mom to administer to the baby. They can usually put that drop right as they're about to nurse the baby, and that's usually a really easy way to get the baby that vitamin D supplement. Children, on the other hand, who are over the age of 1, and this also falls two for adults. So both children over the age of 1 and adults up until about age 65 usually should take 600 to 800 units of vitamin D every day. And that's just like a baseline level. Usually in a multivitamin, you can find about that much if you just read the label and see what's in there. Now, older adults, like we talked about, because vitamin D is so important in bone growth and bone health, should take a little bit more vitamin D every day. They should have definitely be getting that minimum of 800 units. Some of them may even want to be doing 1,000 units a day of vitamin D just to prevent fractures, which can be significant in an elderly individual. Now, I often get questions from people who are taking kind of these super mega doses of vitamin D. I hear people, say, oh, my doctor had me on 10,000 units a day, or, some people have to take the weekly 50,000 units a week or 50,000 units a month. It's variable. I've heard all kinds of numbers from people over the years. Now, yes, there are some times where those high doses are definitely recommended, especially, I've seen people who are very, very depressed and who have very, very low numbers, as we talked about, that you want in that level to be above 30, where, there are some people who have vitamin D levels who may be as low as single digits, 5, 6. Yes, they may certainly benefit from some of those high dose supplements. I have also, though, seen people who will take these high dose vitamin supplements without being properly monitored by their doctors. And then when we check their levels, their vitamin D level is up into the 100s, which is really not what you want, because vitamin D can be toxic to your body if it's way too high. So you just don't want to, go to the vitamin store and think the thought that the more the better, because that's not necessarily true either. So this is definitely one of those things where you want to work with your doctor. And you want to be monitored by your doctor to make sure that you are taking the right dose. But you can safely take those minimal dosages, as we talked about, the 400 units for breastfed infants, for children ages 1 and up, to adults who are less than 65 years old. That's 600 to 800 units a day. And then for those older individuals, 800 to 1,000 units a day. Those dosages are usually safe, but definitely be careful for those those people who like to take these mega high doses of vitamins, because just because it's a vitamin doesn't necessarily mean it's going to be safe and not without some risk. So just remember that tip. Well, thank you for tuning in. This has been our chat today on vitamin D deficiency. As always, please talk with your doctor before following any advice, and anything that I talk about is not considered medical advice, just for you. I am, however, accepting new patients at the Essence of Health Wellness Clinic, located here at 752 East Martin Luther King Boulevard, right here in downtown Chattanooga. Please feel free to visit www.essenceofhealthwellnessclinic.com for more information. Also, please follow along more on this Facebook page at Essence of Health Wellness Clinic, and as well as my Instagram page, also at Essence of Health Wellness Clinic. Remember, the essence of health is in you. Thanks for tuning in.